Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Just how dangerous are painkillers? We're going to try to get to the bottom of it with our guest today, Dr. Michael Schäfer from Berlin. Hello, Dr. Schäfer. Welcome to the show. So when is it okay for patients to simply take a pain medication pill, or when do they need to see a doctor?
What is important to mention is that, of course, pain is an alarm signal for the body. So something is not correct, and that needs to be found out. However, when we have like a very simple situation, for example, we have a not so serious injury when we are doing sport, for example, or we had a hangover last night, then we know it's nothing serious, so it's okay when we take 1 or 2 days pain medication. However, after 3 days, I think it is very highly recommended that we will look for a doctor that will help us and that tries to find out more what is behind this pain.
And if the cause of the pain is unknown, patients should go straight away to see the doctor?
Yes, of course, yeah. When suddenly the pain comes out of situation, somebody has no idea why this is, they should immediately go to the doctor, yes, absolutely.
And when it comes to pain medication, one of the most used drugs in the world, I think, is paracetamol. Yes. Is this a dangerous drug to take because it causes some liver damages?
Yes, one has to really look out for this. I mean, it is broadly used even for children because it's very effective in pain treatment, but also against fever. However, we have to really see that we don't come over a maximum recommended dose, because the twofold higher dose, when we use this, we already have the problem of liver damage. Mm-hmm.
So it's a problem about the dosage. So if you stay at a certain amount of milligrams of this drug, it's safe. But if you use more than, say, 1 pill, or so what's the daily recommended dose for adults?
So, I mean, you can say maximum should be 4 grams. So you take 1 gram 4 times a day, and in between 6 to 8 hours. Mm-hmm.
One of the other big pain medications is aspirin. So what are the problems about aspirin?
Mm-hmm. Aspirin is quite effective. However, it has serious problems concerning gastritis, for example. So it's not so well tolerated by the stomach. And therefore, one has to look out, specifically older patients and people who have already problems with their stomach.
Mm-hmm. And what about internal bleedings? I mean, aspirin makes the blood thinner, one says. So can I go to the dentist, for instance, get some tooth work done, or is it dangerous for me to bleed?
I mean, there are many patients that have low-dose aspirin, not for pain, but for cardiovascular problems. So for them, I think it's okay if you go to a dentist and have some kind of intervention. However, if you have higher doses, for example, patients who have rheumatoid arthritis or so, then they come into problems. And exactly, I mean, the effect of aspirin is a long-term effect. So it's not just the time the drug is effective. It lasts for several days, 4 to 5 days, that you have problems with bleeding, yes. Mm-hmm.
What about Diclofenac and Ibuprofen? Strong painkillers or more mild painkillers? What do you think?
Diclofenac is a very potent painkiller. However, it has also problems with gastritis. And whereas ibuprofen is much more tolerated, it has problems with gastritis, but much less than Diclofenac, yes.
Can you get addicted to Diclofenac or ibuprofen?
I mean, not in terms that you really get addicted. Some people take it regularly because they think this is this is not a problem. It just doesn't have any risks. But they cannot be addicted, like, for example, opioid drugs. Mm-hmm.
And maybe that's the key in pain prevention or treatment, getting active. So what do you suggest patients who want to get active?
Mm-hmm. I think patients are very grateful if you let them take control. However, you have to advise them what is best for them, and it depends on the situation. For example, if you're under a lot of stress, you have maybe something called tension-type headache. It's much better that you go into like relaxation exercises. However, when you have other diseases like osteoarthritis, for example, it's much better to do maybe, how do you call this? Physiotherapy.
Physiotherapy,
exactly.
Right.
I'm sorry.
Yeah, just to get into movement, and perhaps this may just decrease the pain. pain has a habit to stick around a while. So even if the disease underlying the pain is gone,
right.
pain sometimes just stays around, which is called pain memory.
Yes, exactly.
So can you do anything about the pain memory?
Mm-hmm. I mean, these are processes, it's like a circuit that
just goes round and round and cycles.
Goes around and gets stronger and stronger. And it's very hard to reverse these processes. You can do different kind of approaches. However, it's very hard to go back to the situation just before the pain started.
Oh, really? So which patients are prone to getting a pain memory effect? Is it just if the pain gets very severe, then the body remembers the pain, or are there some types of patients who are very prone to this effect?
I mean, there are some patients, for example, patients who have an amputation, they're very prone to these kind of things because it's very hard to treat the pain. And the problem often is that patients too late come to a pain specialist, for example, or to pain therapy. So they try on their own for a couple of months and maybe years, and then it's often too late. So the whole process of chronification has already occurred.
And what do you do against this memory effect?
I mean, you can do treatment, drug treatment, of course, but I mean, the chronic process also comprises other factors. I mean, of course, you run into social problems, into problems at work, you have psychological problems. So all these factors more and more influence your chronic pain, and therefore you have to deal with all these factors and not just with one factor, and you just treat with drugs that would not be effective.
So it's not just one single disease, there are multiple factors. Like, what about fear and depression?
Yes, of course. I mean, this is also a very strong amplifier of pain, and we have to deal with it. And if we see patients that suffer under this, we have antidepressive medication for them. And it's very good also that sometimes they have an effect that they inhibit also the pain. So they're not just for the depression, they also are effective for the pain treatment.
So not just for the mood, but for the physical pain the
Exactly.
patient experiences. Yeah. If a patient tells you, no, I don't want to take any drugs, I don't want to take any medication, what do you suggest for alternative medical things you can do?
Mm-hmm. I mean, there are many different kinds, as I already mentioned. Physiotherapy is very good. Especially, we have most patients have low back pain, for example, and the medication only helps them to bridge a certain period of time. However, they have to use this time to get more into physical exercise, to make their muscles stronger, so that their back is more relaxed and that they have less problems.
Great. Thank you, Dr. Schäfer. Thanks for being in the studio. Thank you.
Thank you.